Hi, my name is Amanda Martin, and I am the Director of Community Initiatives for a nonprofit located in Mecklenburg County called Promise Resource Network. Outside of my job label, I wear a lot of other labels in the community. Some of them are self-imposed, and some of them not so much. And I'm fighting every day to destigmatize all those labels. But some of them are previously incarcerated person. I spent 5 years incarcerated with the Department of Public Safety here in the state of North Carolina. I'm also a person who is in long-term recovery from substance use, and I'm also a person who is in daily recovery for my mental health challenges. Some of those challenges led me to be incarcerated in other ways. Whether that was self-induced because I chose to go to the hospital, or whether it was because someone made that choice for me. Being in the hospital is absolutely one of my lived experiences, and it is the hardest one for me to bounce back from. A lot of things were taken away from me when I was institutionalized in the hospital, and so the bounce back from that has been rough. One of the things that I have been able to use in my recovery and wellness, and now I'm able to facilitate so that other people can utilize these things, is what is called Psychiatric Advanced Directives. And though I have not had to use my pad since I have had it, I do have one in case something happens, and I am involuntarily committed. Because the reality for me is that I never know when that can happen for me, when my wellness just isn't there and I'm hospitalized. So Psychiatric Advanced Directive is a legal document. It's a legal tool that is written into law that allows me to have my voice and choice heard when I am in emotional distress. When maybe I can't speak for myself, it allows me to have other people in my life that can speak for me and share my wishes. It's ways I can make sure that clinical staff hears me as well as my family and friends. So I have found a lot of value in Psychiatric Advanced Directives. If I could share one thing with mental health professionals, psychiatrists in particular, about the value of Psychiatric Advanced Directives, I would say this. Your job is to do no harm. And when we intentionally or unintentionally leave out information that could be imperative to someone's wellness or success, that is doing harm to someone. Whether someone is in the middle of a psychiatric crisis, or whether someone's on their journey of wellness and is rocking that thing out, all of those individuals deserve and have the right to have a voice and a choice heard. As a professional, whether it's a professional as a psychiatrist, as a clinician, or me as a peer support, I am here, you are here, we are here to plant seeds of wellness, resilience, and recovery in everyone that we come across professionally. So I want to challenge psychiatrists and other clinicians, other people that hold roles in a professional level within the mental health system, to value that voice and choice for others as much as I value it for myself, as much as you value it for yourself as well. Plant the seed of wellness, and it's okay if you don't get to see it grow. Hopefully there are other people in that person's life that can water that plant, that can water that seed, that can watch it grow and harvest and bring all the beautiful fruits that people like me are capable of producing and are worthy of having the chance to produce. And sometimes all we need is that one person to hear our voice and our choice. And that is empowering. That is a powerful, powerful tool that you each have to give to people that you run across every day that you provide services for. You offer them power. You offer them a seed that can be watered and grow for years to come. And I promise, we don't forget about the people that walked with us on our journey, And we don't forget about the people who truly invested in us and truly wanted to see no harm done to us. Some of the barriers that I have experienced and that I've heard from the experience of other people around getting a psychiatric advance directive is fear. System involvement causes fear on many levels, causes re-traumatization in ways that people that have not experienced trauma or system involvement may not understand. But there's a lot of fear involved with being a part of the system again, whether that is the medical system, the criminal justice system, the school system in some cases. There's a lot of fear around that. And when you throw in both the medical system and a criminal justice system together, people experience a lot of fears. So to hear that a PAD is a legal document can strike fear in the heart of people in their minds as they consider, do they want to create this document or not? Another barrier is people aren't able to hear about these things at the end of their inpatient treatments while they're in hospitals. This isn't given out freely to individuals as they finish their inpatient stay, as they come to the end of their IVC. All these things, no one is giving information about psychiatric advance directives, about having a voice and a choice. No one is telling the people that are in the hospitals that there are these options. So lack of knowledge is also a huge barrier. And that's lack of knowledge on both the recipient, the person receiving services, and the people giving services. I heard from someone that psychiatric advance directives were not covered in clinical rotations and in the knowledge that clinicians get. And this is a disservice because that is a barrier to why other people who really could utilize a psychiatric advance directive are not creating them, because the people who they trust to give them service know nothing about them. And then they're fearful when they finally do find out about them because they're tied to a legal system and a hospital system, both of which have disenfranchised them and have oppressed them to this point.